Good day, viewers. Welcome once again to another edition of Sight Ed, the sight educational program designed specifically to enlighten every one of us on eye health issues. I remain your host, Feyi Adepoju, preserving vision, restoring sight. Today we will be looking at a somewhat interesting topic, sometimes unnecessarily frightful to people. But that is why we're bringing up the topic today. Eye surgeries. As I said that, oftentimes when you talk to a client or a patient that you might be needing surgery, the first thing is, on the eye? Oh, sure. So today we want to demystify as well as answer several of the questions burning on our mind as it relates to eye surgeries. The consultant ophthalmologist that we have interviewed to talk to us about eye surgeries, when do we do eye surgeries, why do we do eye surgeries, and what all of us need to know about eye surgery is Dr. Latifat Bukola Olokoba. Happy viewing.
Yes, eye diseases can be treated in a number of ways, part of which is surgery, part we give eye drops, or we give glasses. So there are some diseases that it's only surgery that can be done to cure it or as a form of treatment. Not all diseases can be treated with eye drops or glasses. Some it's only surgery, and surgery alone that can be used as a form of treatment for it. So there are different types of eye surgeries. The common ones are cataract surgery, pterygium surgery, or surgery for retinal disease, trabeculectomy for those with glaucoma, and squint surgery. That is the type of surgery we do for people that have eyes that are deviating. Maybe one eye is deviating or even both eyes are deviating. The eyes can be corrected and straightened surgically, and that is why we do squint surgery for them. The surgeries can either be, there are two types also, that in the sense that patients can either be put to sleep or they can be awake and they'll be hearing us as we talk and as we do the surgery. This is what we do commonly for eye diseases. Most times we don't put people to sleep. The person is awake, is hearing us as we are doing the surgery. But there are times that we have to put the person to sleep, particularly children, because children cannot cooperate with us. So in that situation, we put them to sleep. And there are some surgery that can take long, maybe surgery that takes more than an hour or more. We can decide to put the person to sleep. Our people have a lot of misconceptions about eye surgery, which are not true most times. Our people believe that once they say you need eye surgery, they are going to remove your eyes, wash it in a bowl with water, and then put it back. That is not true. We don't remove people's eyes. We just make tiny incision on the eye, and then the part that we need to remove or the part that we need to be corrected, we correct it. It's not as if the entire eye will be removed and washed and then put it back. No, we don't do that. Just a small incision on the eye. Some also believe that this child is too young to have surgery. Surgery is only for old people. No child is too young to have surgery. In fact, if a child needs to have surgery and is not done as a child, when the child becomes grown up, it may even be too late for that child. So no child is too young to have surgery. Likewise, also nobody is too old to have surgery. Who say mama is too old to? No, nobody is too old and nobody is too young to have surgery. If anybody needs surgery, then surgery should be done on them. And then lastly, people believe that if somebody's eye is not straight, then that person has supernatural powers and that eye should not be corrected. This is not true. Several eyes have been straightened and the child did not die and nobody died in the person's family. So if there's a patient or there's a child or even an adult that has one eye deviated or not looking straight, a condition we call squint, it can be corrected with surgery and the eyes will be straightened and the person's powers will not go away, or nobody will die in the person's family. The eyes will be straight, and several has been done and it's been successful. So we should not fear to have surgery on the eyes. So after surgery, what next? The eye is covered with a bandage or plaster, and it is removed after a few hours or after a day, depending on the type of surgery that is done. So the person is given some eye drops, maybe one, maybe two. It is very important for the eye drops to be instilled at the right time. It can either be every hour or every 4 hours. Whatever instruction that is given to the person, is important that the eye drops are put, and the eye drops must be kept clean. We do not remove the cover and put it on the table. We put it in one hand and we instill the eye drop with the other hand. We should not clean the eye with just any cloth, be it a clean handkerchief, white, black. We should not clean the eye with a cloth. The best thing to clean the eye is tissue paper. We'll remove some, wipe the eye, and we'll throw it away immediately. At no time should we clean our eyes with cloth or handkerchief. Whoever is going to put the eye drop into our eye, the hands must be clean. You should not use dirty hands to put eye drops into the eye. And also, the person also should maintain hygiene all the time. It is important that dirty things, dirty objects do not get into the eye, or else infection will set in, germs and microbes will enter the eye and will spoil the person's eye. So hygiene is important, and cleanliness for the eye after surgery. Also, usually after surgery, we will give the person time to come back for checkup. It is important that we come back for checkup. We should not say, my problem has been solved, I'm not seeing before, now I'm seeing, and then we'll go away. No. Anytime we are asked to come, we should come for checkup, even if we don't have complaints, so that if there's anything that is starting, we can quickly correct it and do something about it before it becomes a big problem. Yes, it's possible, but most times nothing goes wrong when it is done in the proper place and the right person, an expert, is doing the surgery. But despite that, occasionally we have complications. Complications do occur. So when complications occur like that, the best thing is to go back to the person that did the surgery and tell him or her what you have noticed, so that if anything can be done, it is better if it is done immediately and as early as possible, so that it can be treated and the sight can be preserved. Also, our people go to how will I describe them now, what we call cultures. They are traditional people that do cataract surgery or eye surgery in remote areas. They may also be in the cities, but they are common in the remote areas and in the villages. What these people do is they push what we call the lens inside the eye, and still they cannot restore vision to the person. In fact, they even cause more damage and more complications for our people. So when we see this group of people moving from place to place, telling them, we can do surgery for you, we should not go to them. We should go to a proper, well-established hospital anytime we have eye complaints, to have our surgeries done. We should not do it under one uncompleted building or in the bush or in improper places. Anytime we have complaint with our eyes, we should go to the hospital and talk to the experts in eye care. They know the best medication to give us, and they know if we need surgery or not. So when there's an injury to the eye, the best time to treat that eye is as soon as possible, because if there's an injury to the eye and it's not treated early, some other complications can come in and will not be able to restore vision back to the eye. The best time is as soon as there's an injury to the eye. If the person needs to have operation done, it should be done as early as possible, to prevent some other complication and from developing into the eye. So the surgery is done, the cut on the eye is repaired, it is stitched together, and then the vision can be restored back to the eye. When it is delayed, germs can enter the eye, it can become infected, and the pressure may rise, and the person may even lose vision completely, that you may even have to remove the entire eye. So what can be saved by one or two not so stressful surgical procedure, we may now end up removing the entire eye when surgery is delayed or treatment is not instituted early as possible. So it's always good for us to take up treatment early, be it injury or whatever eye condition that we have. Once we are offered surgery and once we are offered treatment, we should take it up. Eye surgery is very safe now. In the past, there may be one or more complications, but now there are advances in the equipment we use, there are advances in our techniques. More people are trained to operate on the eye now. So eye surgery generally is very safe now. So once we are advised to have surgery in our eye, we should not fear and we should not delay. We should take up the surgery, because most time, in most cases, when it is done as early as possible, the outcome is good. It is when we delay or we perambulate, we apply what we don't have to apply, and that is when complications will start setting in. But if it is done as soon as possible, in the right place, by the best hands available, most times everything is fine and vision can be restored to the eye.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Well, welcome back from that interview segment. We would have loved to show us a video clip of what surgery looked like, but some of us may not be willing to watch that. But it was just to show us that we do not, and I repeat, we do not remove eyeballs, work on them on the table, and then put them back at the end of the surgery. We really just don't understand where people got this kind of impression. And it's an impression that's been going on for years and years and years. The truth of the matter is, we don't have to remove the eyeballs to work on it. We just do whatever repair we need to do, and usually and oftentimes under local anesthesia. That means the patient do not necessarily have to be put to sleep, and then after the surgery, they're done. Okay, thank you very much once again, Dr. Latifat Bukola Olokoba. Now we're going to go on into the second segment, and we'll watch another short video clip on ocular injury. We'll be seeing another way by which several things can injure the eyes. Happy viewing.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Mama Ngozi, what nonsense is this? Don't you have manners? You are a fool. You are incorrigible. How will I leave this since morning to come back and meet an empty pot and bread? What nonsense is this? See, the train that your party did not give you at home, I will be the one to give you. Anofia, Ekwensu, Onyara.
You call me Anofia?
Yes! Yes! Yes!
You are a fool. You are a madman. Onyara.
Hey! Mr. Chinedu! Stop! Ah!
Open the door! Open the door! Open the door!
You are very stupid.
Hey! Stop! 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 Ah!
Stop it!
Madam, stop it!
Ah!
What is it? Ah! they do? What is all this nonsense? You are fighting your woman. It's very bad now. Sit down. Sit down. Mama Ngozi, don't do what you later regret tomorrow. You will kill your husband.
Let me kill him. Let me kill this useless man. Leave me. He will leave home his money. He won't leave money for food. He will now come back, beat me up when he return from his push up. Animal.
If you hit your husband in a dangerous place, particularly his eyes, na blindness be that oh. And remember, your husband is the father of your children. Stop all this wahala. Stop all this yes, shouting. Baba Ngozi, enough is enough. A word is enough for the wise.
Sighted.
Preserving vision, restoring sight.
Sighted.
Celebration starts from here.
Yes.
From
we
here,
need to
uncle.
celebrate.
Let the celebration begin. One time. Yes, uncle.
Uncle. Uncle.
Jesus. What happened? What happened? Hey, let's go to the hospital.
Wait. I need to take you to hospital.
Sorry. Jesus.
No, that way. This way.
Uncle, sorry.
Uncle. Sorry. Uncle. Sorry.
So please, I'm very, very sorry. You see, the damage is so extensive, and I don't think the eye can see again. You see, in attempts to repair the eye, there is tendency for us to remove the eyeball. So, I'm deeply sorry. Excuse me.
We really need to celebrate. Yes. From here, we can even go out and I will take you out, uncle.
Hey, Mr. Man, hey. Please, when you want to open it, please don't do it like this. Do it like this. Point the head away from your eye. Because if you remove it like that, it can damage your eye. Even it can lead to blindness.
Thank you. You mean I should turn the head the other way around, away from my eye? Thank you.
Thank you very much,
I
sir.
think Uncle has a very strong point.
Yes.
Because by the time you are shaking, you must have generated additional pressure inside of you.
Pressure.
Such that the cork can remove explosively. And if it hits your eyes, it can damage the eyes. Uncle, I know it's like you are becoming an ophthalmologist.
Thank you, sir.
Congratulations.
Thank you.
Congratulations.
Join us now.
Let's watch it together.
We will not
Congratulations. You just bought this, eh?
Yes.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Today we'll be talking about alcohol and methanol and its effect on the eye. Alcohol isn't new to any one of us. It comes in different forms: beer, gin, whiskey, ogogoro, sapele water, apeteshe. burukutu. You know, there are different forms of alcohol being taken in our environment. And most often, the people that are lower down on the economic scale seem to take a lot of this ogogoro component, called by different names in different parts of the country. And the richer ones also take alcohol, they take gin, you know, called by very expensive names. But like everything in life, moderation is the key. But when you take a lot more of it, it could have various effects. Alcohol, we know, have various effects on the body. But particularly right now, we are concentrating on the eye. What could happen if somebody takes a lot, maybe it's in the bar, it's in the pub, so many places, in the marketplace, it could get drunk and begin to fight. So injury from all the fights and throwing tables, throwing stones could affect your eye, injure your eye, and you may need to be rushed to hospital for eye care. You could lose your vision. The vision could be, you may need to spend more money to take care of your eye. Different grades of vision loss can actually happen to you from that injury. And then besides the direct injury from fights and, you know, broken bottles, broken tables, you know, there could also be the one that affects the major nerve that controls vision, what we call the optic nerve. In the medical world, we say optic neuropathy. It can cause brain damage, and because the control of vision is also in the brain, it may also damage the parts of the brain that contains the vision components. That's one part of the damage that alcohol can do, and then it will result in poor vision.
All right, viewers, welcome back from the video clips on ocular injury. And I'm sure you again have enjoyed ASCII, telling each and every one of us on how to prevent ocular injury. When it comes to eye injuries, prevention is not just better than cure. Prevention is actually the best cure. So until we come your way next time, please keep interacting with us on all our social platforms. All of our interview segments are actually by now on YouTube, and so we can go back there and watch, and you can keep sending your questions. Well, this is still Faye Adepoju, your regular host on Sighthead. Sighthead, preserving vision, restoring sight. That's our collective responsibility. See you next time.
I'm Dr. Lokoba Latifat Bukola. Keep watching Sighthead, preserving vision, restoring sight.
Keep watching Sighthead, preserving vision and restoring sight.
I'm Faye Adepoju, your host on Sighthead. Keep watching Sighthead, preserving vision, restoring sight.